Hello and welcome to this session. We have with us Luke Montagu, who's the founder of the Council for Evidence-Based Psychiatry in the UK. An interesting fact, Luke is a British nobleman and he's the heir to the Earl of Sandwich.
Thank you, Kumaar, for the introduction. Yes, yes, indeed. My father is the current Earl of Sandwich, and he actually has a sandwich business of all things. But I spend my time between London and Dorset, where we have some property, and I spend my time there doing interesting things linked to farming and the environment. But when I'm in London, I'm focused on this organization that we have called the Council for Evidence-Based Psychiatry, which I set up on the back of my own experience. I felt it was very important that things that I hadn't been told as a patient were widely available to a much larger percentage of the public, along with the research to support these points.
Luke, you were a patient of psychiatry and were on psychiatric medications for almost 20 years. And what made you sort of want to give up, and what was that journey like on tapering off and the whole business of withdrawal symptoms?
So I was put on the drugs when I was around 20. I had had an operation for a blocked sinus, which in those days was quite barbaric and involved putting a needle into the skull, and it was a very traumatic operation. And I woke from it with these terrible headaches and quite a lot of anxiety. Had done something to my nervous system, and for many months afterwards, I felt rather unwell, and I was eventually given Prozac, which was a new wonder drug at the time, and the doctor said this will help. And I don't remember whether it did or it didn't help, but I was left on the drug essentially for 20 years. Over that time, other drugs were added, including sleeping pills. And looking back, it was essentially a misprescribing issue where one drug, the side effects of one drug led to another. At the very end, I was on 4 drugs, 2 of which were treating side effects from the other. And this was a disastrous example of polypharmacy, what we call polypharmacy. And there's no evidence that these 4 drugs together were of any help. No one's ever done any studies looking at the interaction between 4 drugs. I was at the time in 2009, I was running a large film school that I had set up in the UK. And I decided that I was getting sleepy and forgetful and that these drugs were probably the problem. And I went to my doctor and said, please, can I come off? And he said, you can do it the long way or the short way. And I said, well, I'm a busy man, I'll do it the short way. And he took me off cold turkey in a hospital, and it was an absolute disaster. My nervous system felt like it had been ripped into pieces. I couldn't cross the road, I couldn't see, I couldn't think. And I ended up staying in my house for 3 years, unable to function. I lost my career at the time. And I discovered that there is this network of thousands and thousands of people around the world, all suffering the side effects, the withdrawal effects from psychiatric drugs. And in most cases, their situation is denied by the doctors. The doctors have been trained to believe that these drugs are helpful, not harmful. And when their patients come back with these issues around symptoms, the doctors typically will say that that's something to do with the patient's own disorder. And that was what had happened to me. That's why I ended up on the 4 drugs. So I realized that there was something profoundly wrong. And I also realized that there were many researchers and academics who felt the same way. Even within psychiatry, there are psychiatrists who believe profoundly that most of their profession has got it wrong regarding the long-term use of these drugs. So that was the basis for setting up the council. It was to bring together the best thinkers, to present the evidence as clearly as possible, and then to start to influence health policy here in the UK, which is what we've done. So we are the secretariat for the all-party parliamentary group on prescribed drug dependence. That parliamentary group has led to a huge review of prescribing over here. And that review, in turn, is now leading to changes in prescribing, changes in services to support people who've been left on these drugs for too long. and critically changes to the guidelines. So I sit on the NICE committee for safe prescribing and withdrawal. NICE is National Institute for Care and Clinical Excellence. They set the guidelines for how doctors should prescribe, and this is all changing. So in the UK, things are changing, and we really hope that other countries will see this and will follow the changes over here, because potentially a vast amount of harm is being done. In the UK, we have 17% of the adult population taking antidepressants. Half of those have been taking them for more than 2 years, and yet there are no studies saying that these drugs are effective or safe to take for long periods. We do know from recent research that we've done that in 50% of cases of people coming off antidepressants, they will experience withdrawal. And in 50% of those cases, so 25% of the total number of people taking antidepressants, will have severe withdrawal problems. And severe withdrawal problems, sorry, let me just turn that off. Severe withdrawal problems are debilitating. For many people, it means the loss of their livelihood. So this is a looming public health disaster for many countries, and it needs to be tackled as soon as possible.
You're so right, Luke. India is staring at its own, troubles with mental health issues, with the WHO predicting that 1 in 5 people in India have a mental health issue which needs intervention. Unfortunately, we see an entire narrative being woven by proponents of psychiatric medication from the West, who believe that the answer to the problem in India is to increase the number of psychiatrists who can then increase the number of prescriptions. But clearly, your personal experience, as well as the experience of the United Kingdom, is completely the opposite. From what you're saying, psychiatry, at least from the pharmacy side, is not the answer. And what were some of the key findings over the last many years as you've been running Council for Evidence-Based Psychiatry? What are some of the key scientific findings in terms of the efficacy of psychiatric drugs, or, like you said earlier, the mis-selling?
Well, I think to understand this story, you have to go back and look at the origins of modern psychiatric treatment. And that starts with the publication of the DSM, the Diagnostic and Statistical Manual, which is the Bible of psychiatry. And that is now on its 5th edition. And what's interesting about that document is that, unlike other areas of medicine, there are no medical tests to determine whether somebody has a psychiatric disease or disorder. There are no blood tests, there are no brain scans. They've been looking, they've spent billions and billions to try to discover such tests, but the cupboard is bare. And the leaders of psychiatry recognize this. In fact, you now have the previous editors of the DSM, so Alan Francis, for example, who edited DSM-3, is deeply critical of the latest edition of the DSM because of the massive diagnostic inflation and the increase in the number of disorders. And let's remember how these disorders come to be. They don't come to be because there's any slide under a microscope which proves the existence of a disease. They are voted into existence by a group of men sitting around a table. And there are some funny stories to be told about that table of psychiatrists. For example, there was one disorder where they were trying to decide whether or not it should be included in DSM-4. And one of the psychiatrists said, no, you can't possibly include that. I do it all the time. These are invalid, subjective opinions rather than science-based medicine. And when you realize that, you realize that many things flow from that. If the foundation is problematic, then the edifice is eventually going to crumble and you're going to have all of these problems. In terms of the drugs themselves, it's certainly the case that we've known for some time that antidepressants, which are by far the largest category of drug that is prescribed, are only marginally better than placebo. And the clinical significance of that improvement is non-existent. So many researchers would argue that antidepressants are no better than placebo in terms of their effectiveness treating depression and anxiety. They are used and they do cause people to feel better, there's no doubt about that. But all of the trials that were done for antidepressants were short-term. They were based on outcomes typically after 3 months. There have been longer studies, but the longer studies do not show any improvement. But what we do know is that long-term use causes harms. And there aren't just the harms of withdrawal, there are the harms of additional falls for the elderly. There are links with neurodegenerative degenerative disorders. There's a long list of problems that can occur when you take antidepressants long term, and this has not been recognized, and again comes back to this looming problem that certainly we in the West experience, and which we're desperate to see other countries avoid.
Right. Luke, you've had a victory of sorts recently with the Royal College acknowledging the severe withdrawal effects of psychiatric drugs, and a very detailed document and website. Tell us a little bit about that process and how long it took you and what went into this.
Well, all of these things come down to leadership. They come down to people in senior influential positions standing up for truth. And in psychiatry, there have been people who've done that. There have been many who haven't, but there have been some who have. And Wendy Byrne, who was the previous president of the Royal College of Psychiatrists, listened when we went to go and talk to her about the problems that people are experiencing, when we presented her with the research, when many, many patients and patient groups got in touch with her to say that there were these problems. Instead of doing what her predecessors have done and turning the cheek, she actually engaged with the issue. And there are other people in that organization who I've worked with for many years now who were also supportive of the process. So it took a long time, and it was a very public and difficult disagreement to begin with, but the Royal College eventually stood up and recognized the issue and has now published very important guidance on safe withdrawal. Because with all of these drugs, one of the key messages that needs to come across is that you cannot stop them slowly. And some people will think, well, I'll stop it over a month. That's quite slow. No, that is much too fast. Even a month is not enough time for your brain to adjust to the reductions. And there is some new science which has been developed by somebody called Dr. Mark Horowitz, also with Professor David Taylor, who's the editor of the Maudsley Guidelines, that shows that the way we need to come off these drugs is to follow what's called a hyperbolic taper, so that the taper is a curve. You can come off bigger doses in percentage terms to begin with, but as you get lower and lower and lower, you need to come off smaller and smaller amounts, so that you're always doing a percentage of the previous amount rather than a linear percentage of the total amount. And that's a very important concept. And that things actually work at the receptor level relative to the amount of drug in the system. It's not a linear relationship.
Right. Luke, we're coming to the end of this session. Corporate India, of course, and, even non-corporate organizations across the country are obviously grappling with the undercurrents of the pandemic in terms of mental health issues, stress, anxiety amongst their employees. And clearly, organizations will look towards, modern medicine, right? Psychiatry, beginning with counseling and maybe, CBT or any kind of behavioral therapy, and then moving on to prescriptions. Given your experience both as a survivor and as the head of the CEP, what are some words of advice for organizations?
Well, the first thing I would say is that you have to take the World Health Organization data with a pinch of salt. The fact that that organization, and indeed any other organization, tells us that 1 in 5 or 1 in 4, as it has been in the past, are going to suffer a mental health problem in any 1 year, should be scrutinized, because that statistic relies on setting the bar for what constitutes a mental disorder. And if a mental disorder is a subjective thing without any evidence that can be provided through tests, then it's simply down to the definition. And for that reason, we would say that that lacks validity. You must remember that with the tests that are given, certainly in the UK and in the States as well, to diagnose anxiety and also depression, the tests themselves have been developed by the drug companies. So for example, we have something called PDQ-9, and that is commonly used by doctors, primary care physicians. They meet with their patients, they give them a questionnaire, and the questionnaire asks various questions about whether they've been sleeping well, their appetite levels, etc. And then they're given a score based on their responses. And that is what determines whether or not they're then judged to have a mental disorder. Well, guess who developed that questionnaire? It was Pfizer. So you've really got to unpick this, and you've got to recognize that the way in which we determine what constitutes a mental health disorder is flawed. And in terms of the companies themselves and what they can do, well, obviously I would say that they should educate their employees about these things. We have a website, cepuk.org. It lays out the facts, it exposes the myths of psychiatry. I'd encourage people to go there to educate themselves. And I'd, of course, encourage other interventions rather than pharmaceutical interventions in the first line. Pharmaceutical drugs can be helpful in acute situations, and we accept that, but they should not be used long term. And there are lots of other modalities that are much more effective and much safer.
Thank you so much, Luke. I think there's a lot to think about from what you've told us today. And I'm sure a lot of our viewers and corporates will visit the website. We will be happy to circulate some of the research, which is very in-depth, that you have done. We'll be happy to circulate it to them as well. But more power to you, and may your work just grow and grow, because what you're doing is really making a meaningful impact in the lives of not just the current generation, but future generations to come.
Thank you very much. It's been a pleasure.